This is a field that has developed remarkably since the first U.S. patient was treated here in Evanston in 2003. Since then, about 50,000 patients have been treated worldwide, and that really signals the development and recognition of the effectiveness of catheter therapy for mitral regurgitation. And today, that's synonymous with the MitraClip therapy, which is really the only device we have in wide use. The impact has been to provide a treatment option for a large population of people who either have had no option at all in the past or who faced a very high-risk surgical option, which was also not always clearly effective. So we've really transformed the lives of many, many people with this therapy. Mitral repair is a category, and there are several other device therapies that have been CE marked approved in Europe and that we're looking ahead to seeing trials of in the US. And I think MitraClip has set the bar at a very high point for these other devices. One of the biggest pluses that we've seen with MitraClip therapy is safety in a very high-risk population. So to the degree that any other therapy is effective, we're going to be looking for safety as well. The limitations of this device are twofold. On the one side are technical limitations that are based on the shape and function of the MitraClip device, so that not every valve anatomy is suitable. Most importantly, in the United States, it's the type of disease that affects the mitral valve. So we have US FDA approval and Medicare reimbursement for degenerative mitral regurgitation, which involves abnormalities of the leaflets of the valve. There's another large group, probably larger group of patients, whose valve leaflets are anatomically normal, but have been pulled apart or malaligned due to heart failure or disease of the left ventricle or other surrounding structures. And these patients were really not as sure about the effectiveness of MitraClip. One of the alternatives to mitral repair, in which the normal leaflets are left intact, is completely replacing the valve with a prosthetic device. And of course, this has been done surgically for decades, and we've seen great success with catheter replacement in the aortic valve. For the mitral valve, the story is much more complicated, and the potential to replace the valve on the one hand is very exciting, but on the other, extremely challenging. The probably best illustration of the difficulty in developing mitral replacement therapy using percutaneous methods is that since the first human mitral valve replacement implant in 2012, there are still barely 100 cases treated worldwide with a whole variety of mitral technologies. And in that same kind of time frame with aortic valve therapy, for example, we went from first implant to several thousand patients treated in just a few years.